Si tu savais à quel point j'ai de l'affection pour toi, à qui tu n'aurais pas dû me faire ça.
So I finally wanted to weigh in on the healthcare debate, and I wanted to make sure that we don't lose sight of the end goal here, and that is public health. Yes, public health, having a healthy public, is the end goal of so-called healthcare, sick care, wherever you want to call it. So not only would, you know, locking up some of the gaps, like the millions of people who are too wealthy to be on welfare but too poor to afford private health care. So that gap of people whom we can call uninsured, we know that there are millions of those, tens of millions of those. Then we talk about people who actually are on welfare, there are no family doctors. So it's not like your health record will follow you through even a period of your life, say childhood or early adulthood, or it's not like you consistently see the same few sets of doctors, a family doctor, an eye doctor, maybe an ENT. So you look at the few number of Americans who have access to a family doctor. So then you have those people who only access emergency care. And emergency care is not primary health care, but then look at the number of Americans who access emergency care as their primary health care. Those are the central issues that undermine public health. Now, we haven't gotten to the details of, is it a private option, is it a public option? We're talking about public health, having a healthy public. That means that when I go to the grocery store, I won't be coughed on by somebody who's on WIC, or coughed on somebody who's on expensive meds that they get from their doctor. Doc, I need X, Y, and Z. Those people too. So when their children come to school and they have pink eye and they play with my kids, and my kid comes home with pink eye and I play with my baby, and then I get pink eye and I go to work and everybody at work is pink eye, and the people who clean my house get pink eye, and they go back home and they get pink eye. They get pink eye to their parents and their babies and their mamas and their sisters and their brothers. So it all undermines public health. And it's not just that the model of public health in America, this privatized model that we have now, is based on the idea of segregation, that there will be social segregation. And we have for a long time been able to maintain the kinds of social segregation that exclude the situations that I just mentioned. We would go to the same grocery stores. Well, some people shop at Whole Foods and some people shop at Walmart. And they're not necessarily the same groups of people. And the majority of the people we see on all kinds of television programs, big and small screens, reflect more of the Friends category of people. Presumably they have some health care. I don't know. But they're supposedly working middle-class kind of people in an average city of New York City, not average about New York. But then you have the number of people in middle America who think that they work hard and contribute a great deal to their health care and see it as an individual responsibility and right. And I think that if you're not in a high concentration of people, you don't really have the concept of public health. But then the reality is, look at the ways that rural people can take care of each other. Look at the ways that if a child gets ill in school, that other parents would be involved in making sure that the child is okay, even if it's just a kind phone call to the parents. So in many ways, we do have the concept of public health, but we lose it when we say that everybody should stand up on their own 2 feet. Well, even if that person is over there in the gutter, there are some diseases that they are spreading or have the potential to spread to me. So even if I thought that the solution was you take care of yours and I take care of mine, even if I thought that were the solution, I cannot build a bubble around myself. I can put a big Mercedes around me. I can put a big fence around the school, the private school that my child goes to. I can build some high hedges, grow some high hedges around the doctor that I access and the clinic that I need to, where my family needs to. I can sanitize my workplace. I don't even have to come and go when the cleaners are there. Or I can say, I know who cooks my food. I know who picks it and grows it. And I know who's going to eat the food that I pick and grow. that I process. Can you say that? Regardless if you're rich or poor. And so when you have to consider the many ways that we are connected, not just through our potential to make each other ill, but also the potential to make each other healthy. We're not as disconnected, unconnected as this American model of individuality and hence privatization would indicate, that the best solution will come out of the free market and, throw them to the bazaar and see who makes it out alive. Well, we've seen some of our best characters not make it out alive. Throw them to the lions and let's see who makes it out alive. That gladiator model, that martyr model, that Jesus model that has been done, this individuality, this American form of individuality, that really eschews any responsibility to think of things collectively, and so people can lose sight of this public idea of a public, including public health. I think that a lot of that gets lost in this in trying to assert what we call individual freedom. But individual freedom is not only won by the collective responsibility of sending out our soldiers, but I think it is also the collective responsibility of our everyday decisions. Do we recycle or not? How much do we try not to be polluters or not? How much do we, notice what's going on? I mean, there's a man who kept a girl in a shed, fathered 2 children by this girl for 18 years in the backyard. Yeah, hell yeah, you ought to see what's going on left and right of you. And not just that you ask people questions to be nosy, but that you honestly ask yourself, let me find out what's going on with my neighbor, not just to be nosy, but earnestly to inquire if there's any way that I can help. And even if that only means knowing that people have a different situation than I do, and therefore it might determine the way that I vote. It might determine the demands that I make upon my legislators, upon the people who employ me or I employ. If we earnestly gave into the so-called American way, and not even just superficially, we do have a concept of community in America, but this whole this whole Reaganomics thing, it really bit us in the ass. We've always acted collectively and often against one another, but in times for, perhaps even on behalf of one another. I don't need to list the litany of movements of people: war, anti-war, poverty, anti-poverty, race, anti-race. But certainly we move people across class in our nation. These are not nouveau concepts. Change, as Obama says, people say the dream. Well, the dream is that that you cash that check, that it's not just a rubber check on citizenship. And that means something. So to be a patriot, and this means more than just collectivizing in war. I think it means collectivizing specifically for the purposes of peace. So that in wartime or peacetime, where does all that money come from for a public option? Well, let's see. If there's a demand for family doctors, maybe there will be more family doctors. Maybe more people will want to go into family practice. Maybe there will be more schools producing family doctors, more certificate programs. Perhaps there will be a greater demand for the government to say, you know what, for every X amount of people in a certain area, there needs to be a family doctor. And people start trading more in being a family doctor as opposed to a sexy surgeon that you can see on TV. Not even someone like Dr. House or ER, and all of the emergency room people that we like to romanticize about. Third, what was that favorite one of mine? Third Watch. Emergency, the threat level is orange. Yeah. But what does peace look like? What does threat level peace look like in America? Well, that's the part we have to make. That's the hard part, but it only takes dialogue. It's not that difficult even. But you see it at the public town hall meetings where finally some congressmen and women actually decide to go back to their constituencies. People start shoving and screaming at one another. Okay, we got a little punch to us. But do we know enough to stop, take a deep breath, and deeply listen? And remember, not forget. Remember who we are, not forget. Public health, y'all. Public option.